Hey, this is Kane 1906, bring you Medical Monday. This Medical Monday, one of our last ones, we're actually going to be talking about the AED. Last week we talked about CPR, the week before we talked about heart attacks. So this week we want to wrap it all up. We're going to talk about AEDs, exactly what is an AED, when you use the AED, where can you find the AEDs, things of that nature, and exactly what does AED stand for. So that's what we're going to be talking about. Automated external defibrillator is what the AED actually stands for. By the end of this lecture, the student will be able to do several things. First, identify heart failure. So you'll actually know when heart failure is occurring and pretty much when they're going into cardiac arrest. Number two, identify and describe the most common rhythms. So there are two specific rhythms that will actually lead up into a heart attack. We're going to talk about those in ways you can almost I won't say actually identify them because you're not in a hospital setting, but how to actually find the signs and symptoms prior to them actually having a heart attack. Number three, know how to use an AED, because again, that's very important. We'll talk about the interesting facts about an AED. So again, knowing how to use an AED. And lastly, identify and follow the steps of an AED. So all of these we're going to actually accomplish today. What happens when a heart suddenly stops? This is called a heart attack. When this happens, the heart electrical system, it actually is sending a signal to the heart to pump. But when the heart actually stops, there is no signals going across. What I mean by that is imagine that your heart is like that of a drawbridge and the drawbridge is closed. When the drawbridge is closed, cars can drive over the water with no problem. But once that drawbridge opens up, cars are not able to drive over, because now they're stopped. That's the same thing with a heart attack. When there's a signal, or when the heart is pumping like it's supposed to, a signal is being pushed across saying, hey, you're supposed to be, and it does it. However, when the heart attack actually occurs, that's like a drawbridge coming up. No signal is able to cross over, so the heart is not pumping. And if you notice up here on the diagram of the heart as well, we're talking about the SA node. The SA node is the sinoarterial node. This is going to be your main pacemaker. This is your main one, the SA node, and it's up here, located all up at the top. Again, like you can see, your heart has 4 chambers, but we're not going to go into that. In the hospital setting, or when you get on an EKG, if you notice at the bottom, this is the normal EKG rhythm that you see here. This is pretty much what you see on movies and things of that nature. And not to get too detailed about reading the EKG, but you see, you have your P wave, you have your QRS, and then you have your T wave over here. So this is letting us know that the heart is pumping like it's supposed to, and everything is in what we call homeostasis or imbalance. If the heart is damaged by disease or injury, well, you remember we talked about that earlier. If you are arteriosclerosis, clogging the artery, something of that nature, or just damage to the heart, then the electrical system will be disrupted, causing an abnormal heart rhythm. And when you have a disruption in the electrical system, that is not good. Think of it as your power. You know, if there's a heavy wind or something of that nature and a power flickers, that's abnormal. It's the same thing with the heart. The heart has that normal beating, but then it flickers. That's an abnormal heart rhythm. That is not good. When cardiac arrest occurs, there are 2 most common what we call arrhythmias or irregular heartbeats. One is called ventricular fibrillation, also known as VFib, and that's where the ventricles actually just shake. Now, the easiest way to think of it is if you have a clenched fist, so if you ball your fist and you just shake it back and forth like it's quivering, that's similar to what the heart is actually doing. So the ventricles are quivering and no true blood is being pushed through the body. And because of that, a person may collapse. But in addition to that, the heart is not pumping like it's supposed to. The next one at the bottom located here, what us on the pre-hospital setting, on the hospital setting called VTAC. This is ventricular tachycardia. Now, both of these have the word ventricular, talks about the ventricles, the lower sections of the heart. Now, tachycardia, the word cardia means heart, tachy means fast. So they're talking about the ventricles of the heart are moving fast, which is called VTAC. If you reflect back to one of my previous lectures, we were talking about how my mother had a massive heart attack and she was throwing widowmakers. This is what we consider widowmakers, because if you take a look, these look like a tombstone. And if this is not corrected quickly, it will lead to a person dying. So that's what we're referring to. Now, when it comes to the symptoms of both a VFib and VTAC, you're talking about a person may collapse, so they may pass out. More likely, they will pass out. They become unconscious and they stop breathing. When this occurs, we already know what are those 3 letters we need to do. CPR. That's great. You need to initiate CPR. VFib and VTAC can be corrected with the use of the AED. So it's a external electrical signal that pushes or jump starts the heart. So textbook definition: portable electronic device that analyze the heart's rhythm and automatically delivers an electrical shock if an abnormal rhythm is detected. Defibrillation is known as the electrical shock that is delivered to help restart the heart. So basically, you place this AED on a person if they're passed out and they're not breathing. This actual system itself will look for abnormal heart rhythms, and VFib or ventricular fibrillation and VTAC, ventricular tachycardia. They will actually look for those two specifically to help restart the heart. Now, when you need to use an AED, the biggest thing is you need to follow the prompts. One thing is make sure no one is touching the person at all. So that's one of the biggest things, because again, this is a machine and any outside force will actually mess up the actual reading or the rhythm of it. So you want to make sure nobody is around, or you can just say clear so no one is touching a person. You allow the AED to actually analyze the rhythm.
Analyzing heart rhythm.
And you will hear it say analyzing rhythm. Then you follow the prompts. Literally, it is foolproof. Follow the prompts. The AED will either say shock advised or no shock advised.
Shock advised. Stay clear of patient.
It will tell you what to do.
Press the flashing orange button now. Shock delivered.
The AED will either direct you to push the shock button or to begin CPR. AED knowledge. These are some interesting facts. Think about AED usage within the first 3 minutes of an SCA. When we say SCA stands for sudden cardiac arrest. Within the first 3 minutes of a sudden cardiac arrest, the use of an AED can increase the survival rate of over 80%. So basically identifying the signs and symptoms of somebody having a heart attack and then having an AED readily available. So when they pass out or when their heart stops, you connect the AED or you begin CPR. They have a higher survival rate of 80% or more.
And then people started picking up on defense, and I go past, and I go up, I make a layup, I jog back up to the foul line, and I'm holding on to my shorts. I slap hands with somebody, I'm holding my shorts like this, and I sit down on a chair that ain't there. And
4 out of 5 cardiac arrests, what we call 88%, occur at home. So the majority of your cardiac arrests occur at home. So it's likely that if you know CPR or have access to an AED, you're more likely to be able to save a loved one. That's one of the biggest things. As a paramedic, we're constantly getting calls of chest pain or somebody with a cardiac arrest, unknown downtime. Letting you know now, if you have family members who have heart problems, I strongly advise you not just to purchase the AED because they are expensive, but to know CPR, to become certified in CPR. Because again, you are your first responder. You are the first responder. The seconds count. The true first responders are minutes away. It's up to you to initiate that CPR. You're the lifeline. If you don't initiate CPR, they will die. So again, it's very important that you learn CPR, which was in our previous lecture, but also know how to use an AED. Less than 8% of people who suffer cardiac arrest outside of the hospital will survive. We've talked about that before. The reason of this is because if you're in a hospital and you suffer cardiac arrest or you go on cardiac arrest, you're here on the PA system. Code blue.
You calling code? Calling a code.
The patient's condition deteriorates and the code team is activated.
I have a code blue.
So we know that's a cardiac arrest. We know to respond with all of our equipment. However, on the outside, you don't have that. So again, that's why there's a lower chance of survival outside the hospital than inside the hospital. Ventricular fibrillation, or what we call VFib, is present in almost 90% of adult cardiac arrests. That is scary. The only way to stop VFib is with defibrillation. So you must have an AED readily available to try to correct that. Because again, like we said before, VFib or ventricular fibrillation is when that heart is just shaking, it's just quivering.
What is VFib? Well, ventricular fibrillation is a chaotic pattern of electrical activity in the ventricle.
The heart is not pumping. Blood is not going anywhere. Oxygen is not going anywhere. Because of that, the person is slowly dying. We must reset their heart as soon as possible to get to that sinus rhythm or any rhythm other than VFib or VTAC to help them out.
Now, what exactly is VTAC? Ventricular tachycardia is a very fast heart rhythm that begins in the ventricles when both the SA node and the AV node fail to generate an impulse.
The sooner an AED is used, the more likely it will work. What we're saying about this is the sooner you use the AED, the more likely you can correct that ventricular fibrillation or that abnormal heart rhythm. Somebody that has a sudden cardiac arrest has a 7 to 10% chance of loss of survival. Sorry, I'm fumbling all over that. So a person that has SCA, sudden cardiac arrest victim, loses 7 to 10% chance of survival every minute after that onset of a heart attack and the AED is not used. So what we're saying is the longer you take to get the AED to that patient or that victim, the chances of the survival drops drastically, 7 to 10%. So again, the sooner you get the AED to correct that abnormal heart rhythm, the higher the chances of survival. Again, like stated before, you are your own first responder. You must take care of your family. Make sure you get out there. Make sure you train. Make sure you're up to date on CPR and the uses of AED. If you're not, find somebody that's local. Me, for instance, King 1906, I'm with the Tribe of Kings. I'm a certified instructor. I can train you in first aid and CPR. I can train you in the AED usage. You become certified. So it's important that you seek out that training. It is detrimental because, again, you are your first responder, so you must do that. Steps for using an AED. If you take a look at the board, you have several steps. One of them is the AED arrival, and you have remove clothing, you have plug up, analyze the rhythm, deliver shock, and no shock advised. So these are the steps for the use of an AED. As soon as an AED is available, turn it on and follow the voice prompts. Those voice prompts are going to walk you through the steps of using an AED.
Plug-in pad connector next to flashing light.
Notice in certain AED kits, they may have a razor because there are some guys that are hairy like crazy. And in order to get a proper connection or for those pads to get a good sync, or a good analyzation of the rhythm, you must shave that chest hair. So guys, if you got a hairy chest, shave it, please. I'm just saying, shave it.
In the event they have a lot of hair on them, razor is provided that you're able to scrape it down. It does not have to be close shaved.
Removal of clothing. When it comes to that, when somebody is down, unconscious, having a heart attack, all modesty is out the window. I'm just letting you know, all modesty is out the window. Remove the clothing. For guys, open up the shirt. For women, open up the shirt, remove the bra. You have to expose the breast. It is what it is. You want to try to give them as much privacy as possible, but we need that bare skin for better connection. So you remove all clothing covering the chest. If necessary, wipe the chest dry. You place one pad on the upper right side of the chest, and you place the other pad on the lower left side of the chest, a few inches below the left armpit.
Push on them nice and tight, and the AED will tell you what to do from here on out.
Charging. Stay clear of patient. Deliver shock now. Press the orange button now.
Everybody clear?
Shock delivered.
The steps for using an AED. AED arrives, the sooner the better. The sooner it arrives, the greater the chances of that patient or that person living living from that heart attack. You are your first responder. Take care of your family. Please take care of your family. Learn CPR, learn the uses of AED. Get out there and train. You are your own first responder. It is important that you actually understand the steps of AED as well as steps in the process of CPR. Because again, you are your first responder. It is up to you to take care of your family. So if there's any questions, please feel free to contact us at thetribeofkings@gmail.com. Also, if they want to leave in the comments, feel free to leave in the comment section. If there's anything that you want us to cover dealing with Medical Mondays, like an IFIC or a medical kit or something of that nature, let us know. Leave it in the comment section. We'll do that as well. Again, I'm K1906. I'm the medical coordinator for Tribe of Kings. Hope to see you soon. K1906, out.